14 minutes. That's all it took to change everything. Forever. It was about 4 o'clock in the morning. I was 37 and a half weeks pregnant. I woke up with a searing pain in my chest. I just didn't feel right. So I started walking back towards my room. And when I did, my right leg went numb. And that's when I knew something was really wrong. So I looked at my husband and I said, something's really wrong. Let's get the go bag and let's just go get it checked out. So we show up at Presby Plano. And when I get there, we go up to labor and delivery. They put a fetal monitor on me, and I'm not in labor. The charge nurse ended up coming in, and I said, my mom had an aortic dissection when I was 5 years old. And my grandfather had an aortic dissection. And my great aunt had an aortic dissection. So at that point, they called my OBGYN, Dr. Christina Woods. And it was decided to take me downstairs for a CT. And at that point, I knew it was serious because you don't put pregnant women in CTs typically, unless it's a dire emergency. We needed to rule out that I was having an aortic dissection. And that's when Christina came up to me and she held my hand and she said, "You're having an aortic dissection and today is baby's birthday. We're gonna figure out what to do." Aortic dissection is extremely fatal. If it is not caught, half the people don't even make it to the hospital. If they do, emergency surgery is extremely dangerous. And we had the added layer of the fact that I was pregnant, full-term pregnant. It was decided at that point that they were going to care flight me to Presby, Dallas, and that the care flight was going to be there in 14 minutes. When they sent the chaplain in, they told Kyle and I we had to say goodbye to each other. And 14 minutes is not enough time to say goodbye to your husband. And I told him all the things I needed him to tell my family. And we made tough decisions in those 14 minutes. And it felt like I said, a year, and I was in such pain. And then this man walks in, and he's from the care flight team. And he was just so confident walking in, and he had a clipboard. And it was just kind of like, all right, we're going to get you down there. We're going to get you there safely. We're going to get you there comfortably. And at that point, that's when I had to leave my husband.
This particular story was very special, and it is a little bit unusual, but it's not completely unheard of with what we do at our hospital. There are so many cases that we could share, that we would talk about, where people have very serious conditions that other hospitals are not able to accommodate and take care of them in their particular situation. So this one was particularly interesting because it was so acute. It was so, timing was so important, and it was all able to be orchestrated, and both the mama and the baby did well, and that is always our objective, a healthy baby and a healthy mama, and we were able to achieve that under very challenging circumstances.
The Margot Perot Center is where you need to be because you are such a complicated case. It wasn't just going to be an easy C-section. They were going to be doing a C-section, taking care of my child, then automatically doing a sternotomy, cracking my chest, and working on my heart. And the only place that they believed could do this within the entire Texas Health Resources system was here at THR Dallas and with the Margot Perot Center. The Margot Perot nurses made it easy for me to know that my baby was being taken care of in the NICU while I was having to take care of myself. And I remember the first time I saw him, I burst into tears. He was so little, and I couldn't believe we were both there. I love you. You know where we are?
Yeah.
Where are we?
Hospital.
We are at the hospital. What's special about the hospital?
I was born.
You were born here. I remember there was a lot of recovery happening in a room very similar to this. Without you guys, that could have gone completely different. Because I was scared, even though I was probably calm, cool, and collected. It was because I had you guys and the nurse who was on the flight and all those people.
Yes.
May God bless you and your family. It was a privilege looking after you. Carlotta Hernandez, nurse. So she was one of the people who was in the room when you were born. It was never a question in their mind that they were going to save me and my baby. So I have to say thank you, because my story could be totally different. I really couldn't have gotten through this without you, and I think about you all the time.